And now I'm on. So we start again. Thank you very much. Good afternoon. I have no financial interest in this presentation. It's always a challenge for surgeons, whether they are young, old, experienced, unexperienced, to preserve and be careful about the endothelium. No matter how careful you are, you will always disturb it a little bit. There are factors in different patients, different factors, different cases, different patients. You all recognize the list from shallow anterior chambers down to the IOL that you have to implant. Density of the nucleus, volume of infusion, and so forth and so forth. There are some corneal characteristics that might cause problems. In older patient age characterized by a lower endothelial cell density, and there could be a presence of Fuchs dystrophy and diabetes as well in these patients. So you have to decide during the pre-operative testing in the high-risk patients, performing a cataract extraction alone or doing a combination of corneal transplant, cataract removal, and IOL insertion. The patient's symptoms during pre-op examination are severity of guttae, specular reflection, stromal edema, lens density, the anterior chamber depth, and other symptoms. Now, please remember to do your phacometry and specular microscopy as well in these patients. So the Phaco techniques and the technologies, a horizontal or vertical chop procedure reduces both energy used in eye and ultrasound time. And there are benefits of this: power modulation, of course. We greatly reduce the repulsion, we decrease the turbulence, we enhance followability and lower risk of thermal burns, and less, hopefully, endothelial trauma. And all these together result in less total energy used and less endothelial cellular loss at the 6-month post-op follow-up. Femtosecond-assisted cataract surgery is catching up. The effective phaco time can be reduced from about 1 minute to less than 30 seconds, and from an average power of about 23.5% with phaco, only to about 13.5% with a femto. Next subject, use of viscoelastics. There are 3 types of viscoelastics used depending on the patient. The dispersives, like Viscoat, Helon D, and Ocular, they have shorter chains. They coat the endothelium quite well, but are more difficult to remove. The cohesives, like Helon, Helon 5, Provisc and Amvisc, have longer chains. They are easy to remove and facilitate optimal visualization in the eye. The adaptives, like Helon 5 and Dispersives, cohesive under low flow conditions and dispersive in high flow conditions. So the choice is yours. Irrigation and aspiration, of importance that you remove all nuclear fragments. And this is identified by slit lamp evaluation, gonioscopy, and ultrasound biomicroscopy. Most dense fragments found in the inferior angle. 80% of patients with corneal edema diagnosed with lens fragment after 1 day post-op. Intracameral medications. We have TASS. If you remember from before, in Soviet times, this was the news agency in old Soviet Union. Now we changed the name to toxic anterior segment syndrome. Onset 12 to 48 hours following cataract or anterior segment surgery. Steroid post-operative inflammatory reaction, and caused by a non-infectious substance entering the anterior segment. This, in turn, causing damage to the intraocular tissue. So the TASS treatment improves after treatment with corticosteroids. Ocular medical medication implications. There are some that you have to take into consideration, like the incorrect concentrations. I firmly believe, excuse me, it's the air condition from the aeroplane. Incorrect concentrations. I firmly believe that we are using far, far too high concentrations in all what we do today. And this I state because of what we are currently doing research on in Israel. pH might be wrong. Osmolality, a vehicle with incorrect pH or osmolality. Preservatives in a medication solution. Look at your glaucoma patients, for example. All of them have hyperemia. So you have to identify the cause of your problems here according to the ocular medications. Post-op medications, the medical therapy, installation of corticosteroid prednisolone, acetate 1%, and difluprednate 0.05%. It's a newer delivery system with nanoparticles and punctured plugs. And future medicals like Rho kinase inhibitors. We have now in Israel, in our department in research, a slow release system going with punctured plugs, which indeed look very, very promising indeed. So these were the pearls that I'd like to share with you today. I hope you enjoyed it and had some memory out of it. Thank you so much. Toda Rabba.